Good morning. Welcome to day 89 of the DeStress series, Quantum's Liberty. Hope this day is finding you well. Morning, buddies. Some water. This morning on the phone, I have Jeremy with me. Morning, Jeremy. Jeremy is 16, and his mom works with the West River Health System as a critical care nurse. And his dad is a firefighter, and they live in North Dakota. So Jeremy and I were talking about some discrepancies in some discrepancies in the instructions that people are receiving for the coronavirus. And so as a critical care nurse, his mom is receiving the same information that I am as a critical care nurse. And so they are learning. Let's start tapping, because this is something that Jeremy finds very stressful. Thanks, puppy. That was really sweet of you to say hello. Puppy's going to tap with us too. Yeah. So Jeremy, yes, I understand there's a big difference in what your policymakers are saying as opposed to what your mom knows. So that must be really confusing. So let's tap on some of that confusion, because inside of us, we do know that we are 50-50 of different kinds of emotions. So what we can do, hi sweetheart, tapping with Jeremy. So tap on this point right here, because what this point is a 5,000-year-old acupressure meridian endpoint. And so when we tap on this point right here, it slows down the firing to the amygdala, so that the amygdala, instead of sending out so much cortisol and adrenaline and rushing oxygen to our arms and legs to run away from danger, instead it keeps the cortisol levels lower. And actually, in 1 week of tapping and meditation, you can lower your cortisol levels 37% and raise your immunoglobulin levels 113% in just 1 week of tapping. In particular, the IgAs of the respiratory tract, where a lot of the symptoms of coronavirus can occur. In other places as well, as you know from talking with your mom. But so what we're going to tap on is, I thought we'd tap on some of the confusion, because when we have confusion inside of us, sometimes that can lead to some fear, and that would lead us to doing maybe the wrong thing, because our oxygen is, instead of being in the prefrontal cortex where it needs to be to think about the next best thing to do, it's going to the arms and legs to run from danger, which is a very old but effective way to run from danger. But that's not the kinds of dangers that we sometimes need to think about now, these days. But we're talking about coronavirus, so we know, keep on tapping, and nice deep breaths, Jeremy. All right, so in North Dakota, where your mom is working, that's the West River Health System. The CEO, Matthew Shahan, is recognizing that the hospitals are on overwhelm, and they are trying to send people to other hospitals, and those hospitals are also on overwhelm. But it is an area where people are not being asked to wear masks and social distance. But your mom knows from her critical care courses that these are ways to reduce the spread of the virus. And so in the hospitals, they're trying to keep the nurses safe. I know they were talking about that it was USA Today and the staff of the Washington Post. We're talking about that the the plan is to let healthcare workers work, at least last week, to work with COVID-19 positive but asymptomatic. And then it was decided just yesterday to not allow them to work. And this way they can keep the healthy workers healthy. So the plan is to wear masks in the hospital and critical care unit, and to social distance. And so they're doing some measures to take that other people who have been listening to the science of how to handle this pandemic are already doing. So it is true, yes, Jeremy, that the recent science does say that wearing masks is a great way to reduce the spread of the virus, and you can wear them outdoors while you're going for a walk, things like that, because the pandemic numbers are increasing a lot. So this means that we no longer have less numbers of people walking around with COVID positive, but we have more numbers of people. And this is the problem that's going on. Like CEO Jeff Turner of Moore County Hospital District in North Texas said, quote unquote, "Our neighbors, our family members, small town hospitals are overwhelmed by COVID-19 deaths." So he is even sending patients as far away as Kansas City, Missouri, 500 miles away. So the problem is that we have these soaring numbers of cases and deaths, and we need to put that into perspective by really being very, very careful and thinking about the next best thing to do, which we can do. And that would be wearing masks, and it would be socially distancing. It would be not touching surfaces like, fences and benches and things like that outdoors. Washing your hands for 20 seconds, 1,000, 2, 1,000, keep tapping, and with soap, because the virus has a lipid-soluble membrane, so you can break it down with soap. Now, just keep on listening to the science that your mother gives you, because this is evidence-based research, and it's peer-reviewed, and it's recent research. So your mom is getting the best research right now. So keep on listening to your mom, and we're going to tap on immune boosting, and we're going to tap on lowering those cortisol levels so that you can think about the next best thing to do. Now, let's start on, Jeremy knows these tapping points, and so we're going to tap on a little bit of the research with tapping. What we know is that some people are also turning to, and this might happen during the holidays too, people sometimes drink or have some drugs that will help them to feel better during the holidays, and even some people use that to feel better during a pandemic. If you have to use it to feel better because you're in pain, keep on tapping, follow along, you know all the points. And then, so what we also know from biochemical markers, and this is based on recent science too, is that we have a lot of neurotransmitters that get unlocked when we're doing the tapping. And so keep on tapping, just follow along and listen for now, and then we'll tap on Radiant Health and Immune Boost. So all of this is giving us a nice boost of the dopamine system, our reward system. It's unlocking serotonin and dopamine, which in turn unlocks oxytocin, which in turn unlocks beautiful things like nitric oxide and anandamide. And the nice thing is that with this tapping, this is just unlocking these beautiful hormones. And the other thing that nitric oxide is it makes the blood vessels expand in our prefrontal cortex so that we can think about the next best thing to do. And then also, when oxytocin is unlocked, it unlocks these two neurotransmitters, including anandamide, which is our bliss hormone, and it's named after the Sanskrit word for bliss. So what we know about anandamide is that it also docks for the same receptors in your brain as THC, which is the ingredient in marijuana. So when you are tapping, you are unlocking those same receptors as THC. So you're getting this boost of THC, right, through anandamide without taking in any drugs. And the other wonderful thing is that another, the hormone serotonin, when we're tapping away on our tapping points right here, these 5,000-year-old meridian endpoints, acupressure meridian endpoints, we're also unlocking serotonin. And when we unlock serotonin, that also docks for the same receptors in our brain as magic mushrooms, psilocybin. So we don't have to go to any alcohol or drugs. We can just tap along and have all these lovely hormones and neurotransmitters flooding through our body, and that will make us feel way better than any alcohol or drug. And matter of fact, alcohol or drugs will make you feel worse. At least, like, that's my experience. If I have been tapping and meditating all along and then I have alcohol, I find that it actually prevents me from feeling as good as I always do. So let's tap along, and let's tap along on health right now. So let's say that for Jeremy, we know that the tapping is going to help you to have the images in your brain, right, of that confusion. Like, why are my policymakers saying this when it's very clear that the CEO of the West River Health System, Matthew Shahan, is saying we really ought to be wearing masks and social distancing indoors instead of going to these meetings and not wearing masks and things like that. So right now the United States has 2,000 deaths a day. That's a lot. So let's just do the right thing and wear the mask and social distance and blah blah. So for now, let's just tap on what you have inside of you. You have 50% confusion and you have 50% clarity. So what you can do is just tap on these points if you're having confusion, and then you will think about the oxygen will stay in the prefrontal cortex. Those vessels will dilate and stay dilated up there instead of sending oxygen elsewhere, and then you can do the right thing, okay? So let's tap on the confusion, and then let's tap on health. So repeat after me. We're doing the karate chop point. Even though, thanks for bringing this up, Jeremy. I can imagine North Dakota must be going through a difficult time with all this confusion, like what's the right policy. But just listen to your mom. She's got all the data. All right, so even though, repeat after me, I have this confusion inside of me about the best way to stay healthy, I deeply and completely love and accept myself exactly as I am. Even though I have this confusion inside of me about what's the best thing to do next, I listen to the science and to my parents, and I know exactly what to do because I honor myself. I accept myself exactly as I am. Even though I have this confusion inside of me about what's the best thing to do next, I deeply and completely love and accept myself exactly as I am. This confusion, inner eye, outer eye, this confusion about what to do, under the eye, this confusion about all the data, under the nose, This confusion about what's going on in the news. Chin. Aha, I've got it. Collarbone. I know I can get the good data. Under the arm. I get the good data from the science. Top of the head. Even though we have this surge inside the eye of all these COVID-19 deaths outside the eye and all these COVID-19 people who are sick under the eye, I can do my part. Under the nose, I can wear a mask. Chin, I can socially distance. Collarbone, and wash my hands. Under the arm. At Thanksgiving, we can all wear masks. Top of the head, we can stay within our own household only. Inside the eye and not travel. Outside the eye. If we do have guests, under the eye, everyone can bring their own utensils, plates, dishes, and cups. Under the nose, we can leave windows open. Chin point, and minimize the time we spend together. Collarbone point, that is if we have to have guests. Under the arm. At Thanksgiving or any holidays. Top of the head. Our neighbors and our family members are important. Inside the eye. We do this to prevent overwhelm. Outside the eye. Inside of hospitals and health systems. Under the eye. Which CEO Jeff Turner of Moore County Hospital District, under the nose, in North Texas, chin point, and CEO Matthew Shahan, you know, collarbone point, of West River Health System, the collarbone under the arm, is saying the hospitals are overwhelmed. Top of the head. So please keep our healthcare workers healthy. Inside the eye. And yourself healthy. Under the eye, or side of the eye. By doing the right thing. Under the eye. I deserve radiant health during COVID-19. I deserve this lovely radiant health. I see myself walking in radiant health. I see myself talking and thinking with radiant health. I have radiant health with or without COVID-19 in my environment. I have radiant health with or without COVID-19 in my environment. Top of the head. I am in radiant health. I feel the bliss of all these neurotransmitters in my body and brain. All these wonderful happy hormones and this reward system is making me feel great in mind, body, and spirit now. Okay, Jeremy, you have that right there in your body. You have the tools, breakthrough technology. Thank you so much for bringing this to our attention.